All right, I'm gonna start sharing my screen to make sure everything's working on my end. Feel free to keep joining and sharing where you're from. Otherwise, it is the top of the hour, so we're gonna get started here. Be mindful of everyone's time. So can we all see the presentation here? Yeah, I'm getting some head nods. This is good. So first and foremost, I just want to welcome you all to the last part of our four-part series here. Really just launching a career with Mayo Clinic. Today is all about our specialty spotlight. Like I said, we have a great group of panelists today that you're going to get to connect with, learn from their experiences, and hopefully ask some really good questions too. Really excited for today's webinar. A lot of you are familiar with my face, so I won't spend a lot of time introducing myself, but for anyone who's new, who is just jumping in and joining us for today's webinar, my name is Heidi Bjork. I'm one of the nursing placement coordinators supporting hiring here directly for the Department of Nursing in Rochester. Mayo Clinic is where my home base is. I am a registered nurse. I've been with Mayo Clinic over the past decade and have been on my own career journey that I've really appreciated, and along the way have learned a tremendous amount from my peers, my colleagues, and of course, the patients that I got to care for. I am joined by a great group of individuals that we're going to hear from next. So as you can see, we have a group of individuals that will introduce themselves in a moment, but really representing all of our enterprise sites across Mayo Clinic. Each time we connected, I would share a little bit about the different sites and locations, but we also have a lot of different practice settings, specialty areas across Mayo Clinic. And this is a great representation from all of those. So our first topic that we introduced at our first webinar series was all about career exploration, finding your passion in practice. And that looks different for each individual, especially when it comes to the profession of nursing, where there's so many different avenues that you can explore your career, both in starting and as you kind of progress through your career journey. So we're going to start getting to know our panelists, and I'm going to ask them just to share your nursing journey with us, where you started and what inspired you to choose nursing and how you arrived into your current role. So I'm going to have Dan kick us off. Dan, would you be willing to answer this question for us?
Yeah, Heidi, absolutely. Thank you so much for the opportunity to be here today to discuss my journey and our journey as one of the panel members today. We hope that you learn a lot, and I'm sure we will from all of you too. So my name is Dan Tainter. I currently serve as the nurse manager in one of our medical units within the Mayo Clinic Health System in Eau Claire, Wisconsin. It's a 40-bed unit with 20 PCU beds and 20 general care beds. I also oversee our telemetry program for the state of Wisconsin as well. My story is unique to me. I did not start college planning to become a nurse. I initially attended UW-Milwaukee for architecture and went there for a semester, and I enjoyed the work. I realized, though, soon after starting that it was going to be a very long and specialized journey and an educational path that I wasn't fully and financially prepared for. So with that, I had to make a shift, and I came back home to Eau Claire, where I'm born and raised, and I started working. I took a job as a CNA in a long-term care facility and tried to figure out what I wanted to do next. My sister had already started the nursing program at our local technical college, and I knew the career of a nurse was in high demand. It was a strong job, career choice with a strong outlook, so I decided to dive into nursing. I graduated nursing school in 2014 and began my career as a bedside RN and medical telemetry in PCU3 in Eau Claire. I wanted to learn more quickly. I had a lot of energy toward nursing and learning the science and the physiology behind things, as well as refining my ability to connect with patients. I really enjoyed when my patients were higher acuity. So with that, I decided that it would be best to transfer to the intensive care unit. So I did that in about 2016. I applied and transferred to the ICU. Shortly thereafter, after training into several different specialties and really enjoying the work, I had an opportunity presented to be a leader in the department. So I became a nursing supervisor, which was not initially my plan whatsoever to go into leadership. But I realized soon after starting that role that it really clicked with me. I really enjoyed the work that I did at the bedside, but I also especially enjoyed empowering staff, getting them where they needed to be as a nurse in their career and learning from each and every one of them along the way. Um, I did leave the ICU in pursuit of another leadership position, working in endoscopy and pain medicine. I learned a lot about procedural work and sedation. And leadership has really been a great fit for me. I've now been the manager of medical telemetry and PCU3 for the last 2 years, and look to continue to expand, grow, and learn as a leader and a nurse at Mayo Clinic. Thank you.
Thanks, Dan. Now, what a great journey. You've been in a lot of different areas, but it feels like you came full circle already. So, and I love that you shared that there was an opportunity that you didn't quite think was the best fit at the time, and then quickly learned that, oh, wow, I do have other passions. So that's great. Thanks for sharing. Victoria, do you want to share a little bit about your nursing journey with us?
I would love to. Thank you. Hello, everyone. My name is Victoria. I have been with Mayo for 10 years, and what a journey it has been. I am currently the nurse supervisor over our inpatient flow pool and wound ostomy team here at Mayo Clinic, Arizona. Our flow pool is about 170 nurses, and our wound team, though small but mighty, with 11 people, and two very versatile groups, but have taught me so much and solidified my why of being here with Mayo. But if you knew me before I became a nurse, you would have never guessed that I was going to become a nurse. I broke bones all of elementary and middle school, and I absolutely despised coming to the hospital and anything with healthcare. But my mom was a nurse, and I saw not only her why of becoming a nurse, but what it did and what it brought back to her and our family. And I have always had this innate ability to really connect with people. And so I thought that nursing was the profession for me. And so before I became a nurse, I became a trauma tech here at a local hospital, as a PCT, or a patient care technician. And that solidified the fact that I really wanted to become a nurse and give back the same way that I watched my mother do, and make the experience in the hospital different than what I was used to as a child. And so, although I worked at a different hospital, I had my sights set on Mayo Clinic because of our mission, vision, and values that not only aligned with me professionally, but personally as well. And so, my background is progressive care nursing. I have been a progressive care nurse. Very early on, I wanted to be involved in anything and everything, and Mayo Clinic really provided that for me. I became one of the main preceptors on the unit. I became a team lead. I was in so many different work groups and committees, just really feeling like I was not only valued with my opinion and my voice, but part of change. And that gives you a sense of purpose and motivation as a nurse, that you feel like your voice is heard and you have a say in things and process improvement that you see implemented and impacting other nurses. And that involvement really sparked the passion and my journey to really wanting to become a leader. And so in late 2019, I went back for my master's in leadership and administration and started really building on more of those formal leadership skills in addition to my team lead experience. And much like Dan, I had an opportunity that I never thought I would want to go for, but in 2021, I had the opportunity to become the nursing education specialist for my very unit, progressive care. And if I have one piece of advice for anyone, it's take that leap. I really wasn't sure. I didn't know what that was going to do, but I knew that I had Mayo investing in me and providing me these opportunities. And so I took that leap, and it has brought me to where I am here. While I was sitting in the nursing education specialist chair, I felt so fulfilled educating nurses and other staff on all of the things that they needed to know and being that resource for them. There was still that little spark in me that wanted just a little bit more. And again, I feel as if I was put on this earth to help people, but that helping people really turned into fostering the growth and building people up. And I felt most fulfilled doing that in a supervisor role. And so again, with Mayo supporting, I was able to join a 2-year interim assignment as a nurse supervisor. And that's led me here to today. Truly this professional development, not only for me, I'm able to now give back to my staff in the same way that it was given to me. And that's that support, that fostering growth. Like Dan said, that empowerment of others to see what's your why and what do you want to do so that I can help you get there. And so I feel that in my role now, I am able to be the constant in an ever-changing career, and really continue to help build people up the same way that Mayo built me up. And so I am so proud of my decision to become a nurse, but even more proud to become a nurse here at Mayo Clinic.
I love that story, Victoria. And you, of course, have also dabbled in lots of different avenues within nursing. And I wonder if that young PCT, the unlicensed care Victoria, would have thought you would be where you are today. Yeah, incredible journey so far. Yeah. All right, let's hear from Mary. Mary, do you want to share a little bit about your career journey?
Yes, I would. Thank you, Heidi, for including me in this. Um, Hi, everyone. I'm Mary. I am currently a nurse in executive health, and then this is an outpatient nursing position. I have experience in internal medicine, and that's where I met Heidi, who is my wonderful nurse manager. I also have some ICU experience. I had always wanted to be a nurse, but once I got to college, I was a little nervous because all of the nursing programs are pretty competitive. So then I got a little sidetracked and decided to go a different route, and I became a dental assistant. So I worked in orthodontics, and I decided this was not the career for me. So I went back to school, started from scratch, did all my generals again, and then ultimately applied to nursing program, and I got in. I first became a PCA as well when I was in nursing school to make sure this is like ultimately the career I wanted, and it was. So I graduated here in Rochester 2016. I've been a nurse for 10 years, and yeah, it's been a great 10 years.
That's wonderful. Yeah, Mary was one of those nurses that everyone just took a sigh breath when she would step onto the floor, knowing that Mary's going to be on shift with me. So she certainly is an expert in her practice, and she's been supporting a lot of teams throughout Mayo Clinic. So we're so excited to have you here. Thanks, Mary. All right. Claire, do you want to share a little bit about your story here, Mayo Clinic, and kind of what led you to the profession of nursing?
Yes, definitely. I just want to say thank you for being a part of this today. My name is Claire. I'm a registered nurse. I work at our Jacksonville, Florida campus. I have been with Mayo for about 5 years now. I originally started as a patient care technician while I was going through nursing school. I went to nursing school locally in Jacksonville and decided to work at a local hospital just to make sure it was what I wanted to do and that I was really liking the hospital setting in the beginning of the nursing program. I kind of knew from a time when I was young that I wanted to join a career in which I could help others and be in a caring role. And I wasn't completely sure if that would be with nursing and healthcare or if I wanted to go more into education and be a teacher. And so, kind of as I went through high school and then college, I decided that I think I wanted to try out the healthcare route, which now I'm actually looking forward to going back to a master's program for education in nursing and looking forward to kind of tying both of those pieces together. Hoping to be a nurse educator and do lead clinical programs in the nursing world. So I'm really happy that it ended up working out. I could do a little bit of both. I started as a patient care technician on a med-surg unit that kind of focused on pulmonary side of med-surg. And then I became a registered nurse after I finished the nursing program on that same unit I started with. I really felt supported going through the nursing program, working as a patient care tech, and loved the people that I worked with in the environment and thought that it would be a really supportive, great way to start out my nursing career, working alongside some of those same staff members in the nursing role. A few years into being a nurse, I was presented with the opportunity to become a charge nurse or team leader. I was very nervous at the time to, start that role because I didn't fully feel prepared. I felt like there was still so much for me to learn, and I didn't know if I should be the one that, was leading the unit and that people could come and look, for advice and information. However, just based off the support from my coworkers, encouraging me to do something I was a little uncomfortable doing, and stepping into a role that maybe I wasn't fully prepared for, but that I could learn so much about. I decided to go ahead with it, and I've been a team lead ever since. I really love the role because I feel like I get to work kind of in that educator, supportive role for newer nurses and then just other nurses on the unit where I can, help everyone.
I think we lost Claire. She'll join us back. Let's see if she hops on in the next moment. Otherwise, we'll turn it to you, Tricia. Technology works for us a lot of times, but sometimes it works against us. That's all right.
Sorry, can you hear me?
Yeah, we can.
I'm sorry about that. I don't know what happened. And I'm just very grateful for all of the opportunities that Mayo Clinic has brought me over the years. And I'm looking forward to a long time with Mayo Clinic. So thank you.
Wonderful. Thanks, Claire. And certainly there's been a theme so far about taking leaps and, waiting for opportunities that maybe are a little scary, but then ultimately taking that jump and pursuing something that ultimately helps us learn and grow. So that's great. Can't wait to hear from you, Tricia. Can you share a little bit about your journey so far into your role as a LPN?
Thank you, Heidi, for allowing me the opportunity. I have been at Mayo for 20 years. I started here as a nutrition assistant, working with the dietitians in the hospital. That role was not very patient direct. I did more phone calls, worked out of an office, took orders from patients. So I worked there for about 10 years and was getting to the point where I really wanted to try something new. So I applied for a patient care assistant at the hospital, and I was selected to be a patient care assistant on Mary Bryan 9D and E, which is a step-down neuro unit with spine back surgeries. So that was a very unique experience for me and something that I loved very much. After being there for a few years, I realized that being a nurse is really the direction that I wanted to go. So I applied for school and graduated in 2015 with my LPN. And I started my first job as an LPN in outpatient pediatrics. So something that I love and is really my passion. I don't think I realized how much of a passion and how much I loved it until I took an opportunity to step away from peds to executive health. Worked alongside Mary for a couple of years, and then decided that I really wanted to come back to my babies and my families that I had spent so much time with. So I have returned back to CPAM and working here now for about a year again. Along the way, I have been given opportunities to be involved in committees, our Mayo Nursing Council, our division, and that also led me to being able to apply to the Board of Nursing. So I'm also a Minnesota Board of Nursing member.
Wonderful. That is great. Thank you all for sharing your journeys thus far. I want to ask this next question because a lot of the individuals on the call maybe are just getting started and don't really know where to begin. And so maybe I'll turn this over to you, Tricia. Having been here for 20 years, what piece of advice would you give to someone who is still exploring their place in nursing and where they might be?
To really take your leap of faith. If you think that you're interested in something, to go for it. It's scary and nerve-wracking and you feel terrified making that decision, But I would say, speaking for myself and listening to everybody else's stories, really taking that leap of faith really worked out for everybody in the end. Mayo has tremendous opportunities for everybody that works here and those that would be coming in, especially in nursing. You don't have to just be in one area. You have, primary care, you have nursing in the hospital, you have specialty care. So there's so many things that you can get involved in, and pick or choose for your career.
Yeah, I like that. Take that leap. Take that leap. Victoria, what would you say to this question?
I mean, I truly emulate what Tricia was saying as far as take that leap, but I want to kind of talk a little bit more about taking that leap and make sure that you know that sometimes when you're about to take that leap, it feels so scary. But if it doesn't, maybe that's not the leap that you should be taking. And I know that sounds kind of crazy, but anything that makes you, once you're comfortable, it might be time to do something that will challenge you because with challenge comes growth. But truly, my advice is if that you feel that little spark that I referenced me feeling about certain things, that might be your sign to just follow through with that spark and just give yourself the chance to learn what that spark is trying to tell you. Maybe it's that you want to become a nursing education specialist. And so the first step is you set up a meeting with your nursing education specialist and you learn more about what does this role entail and does that align with your passion and what fills your cup. I will be honest, there have been so many little sparks that had I not followed up and through with, I would have regretted. Even if that meant that I followed through with a spark that I felt and I learned that it wasn't for me. But if I didn't do that, I wouldn't be where I am today. I thought that I wanted to be the director of our nurse residency program here in Arizona. I had such a passion after going through it. And I had the opportunity to do that. And I did. And I went back and forth. Should I do it? Should I not? And I did. And I learned that that's not what filled my cup. And what a pivotal moment for me to recognize that's not my place, but being a supervisor is. And now I'm here today. I think going through all of those decisions and journeys led me to find what truly is my place. So my advice is take the leap, keep an open mind, and just give it your all and do it with passion, and you're not going to be steered wrong.
I love that piece of advice. It's okay to try things and for it not to be the perfect fit. I think that's a really important piece of advice that's being shared is that sometimes it clicks and other times it's a growth opportunity. And then you learn maybe what doesn't fill your cup and maybe it opens another door to what does. So that's great. So next question is, can you think back to your first year? So think back to that first year when you're just getting started. What was that one lesson or experience that stayed with you throughout your entire career? Dan, do you think you want to answer this one for us?
Great question. I agree. That is a really important one to nail down because our first year is a really pivotal time in our nursing career. So for me, the best answer for this is humility. The important lesson of humility, understanding that there's always somebody that knows more than you or has more experience than you. But just the refuge in the fact that they are there to help you or they can help you with the knowledge and experience that they possess. And so really latching on to those individuals and understanding that they are continuing to be a great resource for you now. And you'll think about them in retrospect as time goes by as a person who was a really important person to connect with during your first year as a nurse. You'll never forget those individuals who make that first year for you, who advocated for you, were preceptors for you. And so just appreciating them and just understanding that there's always time and room to learn more. One of the things that sticks with me is for new staff to word the question, instead of saying something like, I already know how to do that, instead of saying it that way, phrasing it like, here's what I know about this subject. What can you tell me about it that I don't already know? And drawing on the strengths and experience of those individuals who have already been there at the bedside. That'll show not only that you are human, but that you care to learn and you want to grow over and above what you already know about your own skills, and that you're dedicated to the practice. And so, being human first is one of those important lessons. And that humility during that first year is an important one that sticks with me.
That's great. Mary, anything to add to this question?
Yeah, one thing that I did during my first year, I actually kept a journal of all the things that I was nervous to do, I wanted to do, goals that I had, and then I would reflect on that. So throughout my career, I will still add stuff and look back. And it was really cool to see kind of from the beginning the things that scared me, and then I would look at it a couple of years later and see that, I mastered it. I remember being really scared to take a blood sugar. I don't know why, but and then, 2 years later, I'm reading this and it's like, oh my gosh, like I can't believe I was so scared. Now I could do that in my sleep. But I think it's just kind of realizing, everybody has to start somewhere. And then I think as my career has gone on as like a preceptor and a charge nurse, reflecting on my journal showed me that everybody starts somewhere, even my orientees. So being patient with them and realizing like this was scary for me at some point too. Kind of like Dan said, like the humility and just being open and ready to try new things and willing to maybe, it's okay if you're not great at it right away. Just wanting to get better is great too. And then reflecting back on all that growth is very important, I think.
Yeah, that self-reflection piece is super important, especially when we're talking about showing up as our authentic self, especially when it comes to securing your first position. We talked a lot about being authentic, being genuine as we show up, but that's easier said than done. So curious from the panelists, let's turn over to Claire. What would you say? What does it mean to bring your authentic self to work as a nurse each and every day?
I think bringing your authentic self to work means truly showing a side of you that others can relate to. And I think that goes for your patients and then also your coworkers and teammates. There is a level of profession that needs to be held as being a nurse and working in healthcare, and that's very important. But you also have to bring a side of yourself to your job to show others that you are human. For a lot of the patients that you're interacting with daily, it can be the hardest day of their life. It can be a really difficult time that they're going through, and just being able to show them that you connect with them and that you have something to relate to and you're also human and you've also had bad days, I think is really important. And then that also goes towards your teammates and coworkers. There are things in life that we can't control and that may come over into work as hard as we try to leave them out. And I think just at the end of the day, remembering that everyone has good days and bad days, and everyone has a life going on outside of work at the hospital. I think it's really helpful to be able to connect on that level. And I know for certain times for me, I've been able to share things with patients that really made them feel like they were talking to a friend or somebody who really understood what they were going to, or where they didn't just feel like, I was a nurse coming in with a questionnaire and I just had to check boxes, but I was somebody that could sit at the bedside with them and share my story and listen to theirs. And it was somebody that they could just talk to and relate to, instead of just being seen as maybe a professional walking in the room who was there to just, make sure the chart was updated and vitals were taken and give them their medication. But it was somebody that they could really lean on in a time of need, and also to share small joys with when good things do happen in the hospital and there's little celebrations to be had. I think that's really important, to show a side of yourself that's honest, and people really respect and relate to that. And they can tell when you're being genuine. And I think it really comes across in a meaningful way. And people are very appreciative when you're able to, give some side of yourself other than just the professional side.
Yeah, simply put, right? Being humans, taking care of other humans, right? Yeah, so important. Tricia, can you share with us a moment when being yourself helped you connect with a patient or a colleague or a team in your practice setting?
I think the one that renaissance with me the most is a patient that came in. Parents were here with her. They were not getting answers to why she was not feeling well, running fevers. We had been doing things to check for things, but weren't really getting any answers. And I just remember the mom breaking down and sobbing and saying, I just feel like I'm being a hypochondriac. I keep bringing her in and I'm not getting any answers. And I shared my experience of finding out that my daughter was type 1 diabetic. And I told her, you are the person that knows your child the best. You keep bringing them in, you keep advocating for them, you make sure that you're being heard. So being able to share that personal experience with her, she took very serious, and she came back for several appointments until we did find out that there was some sort of an infection, and I don't remember the details, but just being able to advocate for your children coming into the clinic, and not taking no for an answer when you really feel that there is something going on that's not right.
Yeah, you really connected with that individual and it allowed them the permission to continue to push and advocate for their loved ones. I love that. Dan, does a moment come to mind when you hear this question?
Yeah, it does, definitely. And, you know, connection is key. I think no matter if it's a patient, a colleague, a provider, whomever, I think the human connection piece and trying to come up with a common thread is a great way to connect. And I cared for a patient who was a landscape photographer, and I like the outdoors. I like nature a lot. And he and I had a lot of conversations surrounding his work as a photographer. And that really brought his stress level down because he was able to, for a second, kind of get away from the fact that he had a major surgery and was recovering. And it was a kind of a rough recovery. And but it allowed him to just escape that for a little bit and connect with me through a space that was so clearly a very important part of his life. We kept in touch, and he, to this day, I remember him in great detail and appreciate the connection that we had together, me as his nurse, he as the patient, and how we got through that. I mean, he didn't realize it at the time, but I was newer to the role. And being a new nurse, I was stressed too, that he was stressed, and I was hoping I was doing everything right and okay. And it helped me too to kind of share that trust and conversation surrounding something that he and I had in common.
Yeah, I love to hear these patient connection stories because it's so fulfilling, not only for our patients, but truly we are the ones who are so privileged to be in this profession and to grow alongside our patients throughout their health journey. Let's talk a little bit about getting started and our first year as professionals. There are a lot of challenges, right? That first year, things that we don't anticipate, things that we thought we felt really confident in, and then maybe things don't go our way. I want to hear what helped you feel supported as you made that transition from what I call student nurse brain to professional nurse brain, right? From school into practice. Mary, can you share? You were a patient care assistant on the floor, moved to the RN role. What was this transition like for you, and where did you lean into for support?
Yeah, so I was fortunate to be a PCA while I was in nursing school, which helped so much as a nursing school student. But then I also transitioned from the PCA position to the staff nurse on that same floor. So I felt like I had a mentor in almost every single person on the floor. And it ranged from fellow PCAs and environmental services, nurses, nurse managers, some of the physicians, because I was able to work so closely alongside them and ask everybody questions throughout nursing school. I was just, that person people would be like, do you have anything interesting so Mary can follow you? She's in nursing school. But I feel so fortunate looking back on that now that I was able to connect with all those individuals and professionals and my colleagues, because that really helped me not only learn, but build confidence in myself and establish rapport with a multitude of multidisciplinary areas. So I would say that support as a PCA with my colleagues and finding mentors really was what helped support me to transition from that.
I love that you found mentors from all sorts of different multidisciplinary teams, areas that you might not have considered to be someone that you can lean on and to learn from. Victoria, what would you share as a response to this question?
Sure, yes. As I stated in my introduction, I started here at Mayo Clinic in the nurse residency program. So I really want to highlight how important and pivotal that was for me as far as the support as I transitioned from student nurse to registered nurse. And the nurse residency program is what a support system it is. It's a year-long program with the director and co-director who not only serve as the director of the programs, but truly as your mentors. And they structure the program by with evidence-based research to support the new nurse. And so very often, not only do they have, didactic and hands-on lecture to go along with what you're dealing with in practice and really increase your confidence and competence and those feelings of, I don't know if I know what I'm doing and am I in over my head. They acknowledge that very early on and they talk about that transition shock. And those conversations are really important as a new nurse because you question, my preceptor knows all of this and I don't know how she got there. I don't know how he knew to do that. I don't know that. But they really start talking about those crucial conversations very early on so that it makes you feel like you're not in over your head. Additionally, in the program, they have mentorship programs within it. And so you're able to get set up with a mentor outside of your unit, a pair of fresh eyes to kind of give you that unbiased, non judgmental space to really talk about where you're at and offer some advice outside of the unit. And I felt that support there. And that's also a little bit of networking too, and getting to know others and hearing advice from those who went through the nurse residency program and now look at them 5 years later and just getting that validation that this transition shock that you're going into is normal. And, what you're feeling as a new nurse is normal. I feel like that sense of instilled normalcy and them speaking about it really helped. But from a practice perspective, again, they really shaped the program to align with what us as nurse residents were going through. And so I always knew that I had them to fall back on should I ever need anything, but really the support through the program to kind of take what I'm learning and actually see it in practice. And I can't speak highly enough about our nurse residency program at Mayo Clinic.
Yeah, that is great. Thank you for sharing, Victoria. Dan, how about you? How did mentorship, teamwork, structured learning shape your early career, your early experiences?
Yeah, absolutely. I think back to the nurses that I gravitated toward in the ICU, and these were individuals who I held in high regard because they had a lot of specialties under their belt. They were trained into a lot of things, had a lot of experience. And so they were like true kind of natural teachers for me in the work that I did in terms of them being in the same role, in the same department as me. I also grappled onto and kind of formed relationships with other natural teachers within the department. So looking at our nurse practitioners, our physicians who are natural teachers, and really took an opportunity to ask questions to those people anytime I had the opportunity to. And so while I had formal mentors and kind of structured out in my orientation as a part of my role as a nurse, I also had informal, strong teachers that I gravitated toward that I would advise everyone does. I mean, we all have a lot of knowledge to share. And especially when we look between our roles and as care delivery as a part of a team, we all have a lot to learn from one another. And so grappling onto those individuals early on who serve you well, teach you well, and moving forward with their knowledge is what I would recommend.
Yeah, and I'll just echo that there are a lot of individuals out there who want to see you be successful. They want to provide that guidance, that mentorship if you're willing to receive it. Most people want to see you succeed and reach your potential. So don't hesitate to reach out and take that initial step. If there's someone that you feel really comfortable around, or someone that you tend to gravitate to anyway and ask questions, that can be kind of that informal mentor-mentee pairing, if you will. Claire, would you add anything to answer this question?
Kind of similar to Mary's experience. I was also a patient care technician on the same unit that I became a registered nurse on. And so I felt very supported in the transition from being a patient care technician to the registered nurse role by all the staff on the unit. Kind of similar to what she had said. There was the nurse managers, the other patient care technicians, the other nurses. Can you hear me okay?
Yeah, we can.
Okay. Um, And I also was very fortunate to have a very supportive nursing school program where I really connected with the other people in my class. It was a very small program, too. I graduated with just around 40 other students. And so, kind of transitioning into the nursing role, we still kept in contact with a lot of the people in our program and were able to share our experiences as we all started out in the nursing role. And that was really helpful to kind of hear where everyone ended up and where they had started when they became nurses. And I think just having that like close knit community of people who were in that similar role and position of having to start as a new nurse, but in all different areas and ending up at different hospitals and some people moving, back to different states. And then also having the support of my coworkers and team members at work as well.
Yeah, certainly we bond pretty quickly to the peers that go through nursing school with us, right? That's not an easy program to get through, and so certainly there's a bonding that happens throughout that program. So yeah, lean on your peers that are going through that same transitional, part in their career as yourself. So as we start to near some of the end of our webinar today, I want to just take a moment of reflection because this is so important as we continue to move forward in our journeys and always looking ahead. I want to take some time to reflect on what may have surprised you or what continues to inspire as you're looking forward to progressing within your career. Tricia, do you want to start us off here?
Yeah, thank you. I think that really surprised me is how things change. I think that I had this idea in my head when I graduated nursing school that what was in the books is what things were, that is how things were going to be for eternity. And actually getting your hands into nursing and getting the experiences, you see that over time things start to change a little bit by best practice being initiated into your work. The AI that's coming out that is enabling nurses to be more hands-on and less sitting at their desks, trying to navigate through notes and so forth. So there's been changes that are slowly always underground waiting to be fulfilled. And I think that that's one thing that I wasn't anticipating, just being naive coming out of nursing school, that things were going to always be changing.
Yeah, that's certainly the environment we live in. Things are always evolving and changing for the better and hopefully to care the best possible way we can for our patients. Victoria, what has surprised you or what inspires you moving forward?
Yeah, thank you. I think what surprised me, as I reflect about my nursing career is just how much my role has evolved beyond direct patient care and into truly developing and supporting and leading others. Like I said earlier in my career, I started believing that my clinical expertise would always be like my primary measure of success. But over time, I listened to my sparks and I tried different avenues and I succeeded and I failed and I allowed myself to do that. I think that's really goes back to when Dan's talking about humility and giving yourself grace. I allowed myself by taking those leaps of faith to try it and be okay with, all right, that didn't work out, or wow, look what that did for me. And so I was surprised to learn that, that influence and emotional intelligence that I've built and the ability to support a team through change are just as critical, in leadership as it is in bedside. And that's really where that door opened for me. and I'm glad that I took those opportunities. I didn't anticipate how deeply invested I would be in helping others overcome, navigating challenges and finding their confidence and finding their why and their place in nursing and here at Mayo Clinic. And I think that's what continues to inspire me is seeing the light bulb go off for others, seeing the 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 shape of culture and the mentoring future leaders and just kind of like their recollection of their why. When you're sitting down talking to someone and you see that light bulb go off, or you see, this is why I'm doing that, and see just that sense of belonging and passion, that's what continues to inspire me every single day to not only be the best leader I can be, but to stay being a nurse here at Mayo Clinic and support my team and everyone around me.
So happy to hear that, Victoria. And certainly you can just feel that the joy you feel, right? Every day that you get to show up to work and provide care for patients and support our peers. It's very evident from all of you across our panelists today. So thank you for sharing all of your experiences. We greatly appreciate getting to hear from your experiences and learning about your journeys. So, of course, this is how you can stay connected with us. Mayo Clinic, as you know, we've always shared this slide with all of our webinar presentations. If you want to reach out after the webinar series, here's a way to connect with us on different social media platforms. Certainly would always encourage you to reach out if you have questions, want to provide feedback, or just share your story with us. So with that, I'm going to allow individuals, if you have questions for those who are attending, feel free to use the Q&A chat feature there. Drop a question in there if you want to direct it towards a certain panelist or the whole group here. We'll take questions now for the last, about 15 minutes that we have here. Stop sharing my screen so that we can all see each other. And Brittany, I'm going to look to you. Has anything put in either the Q&A section or the chat that you want to help answer?
Yeah, there is a couple questions in here that I can read out loud. Heidi, also your mic is a little bit robotic. I don't know if you can mute yourself and then unmute yourself. Maybe that'll fix it. Usually I have to like log out, but I don't know if that's a possibility. But I can read the first question here and then anyone can feel free to answer. Do you have any recommendations or ideas for novice nurses less than 3 years of experience who are trying to get back into the hospital bedside nursing? I have a little under 1 year of in-hospital nursing experience and had to step away due to family caregiving needs and went to outpatient care, but I'm hoping to return to bedside and I'm having a hard time. You are still a little robotic.
I'm going to turn it over to the panelists then. Anyone jump in?
I can take a crack at this one. And, I think it is difficult at times to kind of crack into a new position. So I can resonate with that. I think the recommendations that I would have is be persistent, be open to possibilities on where you could potentially land or work, and then have a really strong resume cover letter presence. Once you can get an interview, I mean, that's a really good opportunity to obviously shine and show your skills as an interviewee. And, I think in general, just being intentional about every step is important. So really starting with being open to apply to several different places or positions or departments, really nail the resume or cover letter, and then have strong interview skills are what I would advise. Anybody else have thoughts?
I was just going to say, I agree with you, Dan. Be persistent and, be ready to answer those interview questions confidently, have a good resume and cover letter, and just, don't give up.
Thank you both. We'll move on to the next question. Do you have any advice for second career nursing new grads applying for their first job with no prior healthcare experience?
I can take this one, and I think it's kind of a little bit like what Dan and Mary said, but my advice is, when you do keep trying and apply to what you can, all of the nurse residency programs. But when you do land that interview, really pulling from your clinical experience as far as examples go to really show your understanding of what you've gained through that clinical experience and what you have to offer. Typically in those nurse resident interviews, we are very aware that you don't have the experience. And so it's not strictly based off of what experience you have, it's where you're at and what you can exude to us, what you've learned from your clinical experience and from your nursing school. So again, giving yourself that grace, but like Dan said, it's your time to shine. So when you're answering those questions, as much as you can pull from nursing school experiences, that's what they're going to look for because we're looking for where are you at with your critical thinking and the type of experience that you did have in clinicals. But I want to make it very clear as a hiring manager, we don't look for experience when we know we're hiring for a new grad nurse.
I would just add that, as a second career, undoubtedly you have something available to you to draw on it from experience and some skills undoubtedly that you developed over time. Those are important skills to highlight in an interview, to use to your advantage as in your second career as a nurse. There are many people who don't choose nursing right out of the gate. And I think as someone who hires and interviews a lot of people, I'm also interested in people's life experiences that have led them to be a better leader, a better communicator, a stronger presence in the community or whatever it may be. There's a lot of things you can use to your advantage, even without having healthcare experience that would be attractive to a hiring leader.
Great. Thank you both. We have a participant who is interested in the ICU, and they are wondering, is it better to start in med surg to get 1 to 2 years of experience before going into an ICU?
I think this is a great question, and it'll probably vary depending on where in the country you live or what site you're considering on how the hiring is done. I can just draw from experience as a nurse in the ICU and as a leader in our ICU in that people were a lot more successful if they had some really good nursing foundation underneath them. I will say that there are some avenues to enter ICU without experience, whether that be through a residency program or otherwise. But I think it's definitely not going to hurt an individual to have experience as a nurse, nailing down time management, really solidifying those assessment skills, getting those things aligned so you can then launch from that general med PCU level care up to that ICU level of care, knowing that you already have a good foundation. So I do personally recommend a time as a nurse on the med surg level, but that is really just speaking from the ICU that I know and have experience with where I'm at in Wisconsin.
I was just going to add that speaking from my own experience, that was actually the journey that I was planning to take. Coming out of nursing school, I actually wanted to join the ICU and was debating for a while if I would apply to the ICU residency program or if I would just go with the general med surg residency program. And then ultimately, just because I was so supported on the current unit I was working on as a patient care technician, I did decide to stay on that unit and start working as a nurse there. I do know coworkers of mine that went directly into the ICU nurse residency program. So I think you really just have to consider what you feel the most comfortable with from your clinical experience and just pulling from if you feel ready to start directly in the ICU or you kind of want to focus on some of those more basic medical skills first. However, I'm still working in med surg, so there's always the option that you'll find something that you're more passionate about that you didn't, originally think would be your plan. So funny enough, I never went into critical care. And I think that's always an option too, is you might have one journey that you think you're going to take while you're in nursing school and working up to the bedside role. And then once you get there, you might find that there's something else that you really enjoy or end up doing. So the great thing about nursing is that the opportunities are endless and you can always try different things out.
Great, thank you. Is it recommended to submit letters of recommendation with your cover letter and resume for applications?
I can take this one. I think that it's always a great idea. Any letter of recommendation that you may have to speak to, who you are as an employee and your work ethic and your experience. I mean, as far as when I am interviewing, I do look at those. And I do read them, and I think that they're very valuable. And so I would say, yes, if you have one, absolutely. You really only need one. If you have two, that's great. Any more than that, I'm not sure is necessary. But always a great idea. If you have it, please attach that so we can read that and get to know you a little bit more through that letter of recommendation.
Thank you, Victoria. We have one more question, and it is regarding the nurse residency process. So this participant is inquiring if they apply directly to the nurse residency program or if they apply to a specific job opening and then become part of the nurse residency program.
I could speak for Arizona. They are specific job applications for the nurse residency program. So it will clearly state that it's nurse residency program for Arizona, and that is what you would apply into.
Yeah, and for us in Wisconsin, all new graduate nurses are entered in the residency program. So the best way to apply is to look at a position, apply to the position, and the residency process will be concurrent with that.
We have the same process in Florida as well. We have the different nurse residency programs depending on the level of care that you're interested in. So we have the acute care residency program, a progressive care, and a critical care residency program as well. So just depending on what level of care you're looking to enter in, you can look at the job opportunities from there, but all new grads will start through our nurse residency program as well.
I know for Mayo Rochester, when I went through the residency program, it was the same as what Dan had mentioned. All the new grads were entered in the residency program. I'm not sure if things have changed. Was 10 years ago now, I think, 10 or 9 or 10. But that's how it initially was structured.
I can speak a little bit to the Rochester nurse residency as well, just from an HR perspective. So we have changed it a little bit. Mary, you are correct. So all new grad RNs that are hired are automatically enrolled, but we do have a specific posting for new grad nurse residency. So whereas I believe in Wisconsin and the other health system sites, you just can apply to any specialty or department and you're automatically enrolled, whereas in Rochester, we do require applying to that nurse residency posting directly.
Is my mic back? Does the audio sound better?
Your mic is back.
Fantastic. So what I want to reiterate is just make sure you look at the job specific posting. It will either redirect you to the nurse residency program if all new graduate nurses have to apply through one central posting, or it'll say open to new graduate nurses, please apply here. So that should be indicated on every job specific posting to kind of direct you, because I know it is different for different sites and regions as you apply. Great questions. Any last minute questions from the group here? Anything else coming through, Brittany, that you can see?
No, I think we actually answered all of the questions.
Fantastic. Well, I just want to extend another sincere thank you to everyone who joined us today. Certainly your advice your experiences, your guidance is so, so valuable, not only to me, but individuals can always glean and take away different pearls for their own, individual perspective. So I appreciate you all being here. I want to thank you to all the participants who came and joined us today. Certainly appreciate giving us an hour of your time. If you did not get to all the webinars, there will be a recording that will be sent out to everyone who registered for the series. So you can look forward to either rewatching that or sharing that forward if there's individuals who might benefit from this conversation. Thank you all and have a great rest of your day.